Milk thistle, Silybum marianum, is a flowering plant renowned for its medicinal properties, particularly in liver health management. We will learn about this amazing plant's growth, habitat, identification, medicinal uses, and harvesting, providing a comprehensive overview for herbal enthusiasts. Growth and habitat. Milk thistle is native to Mediterranean countries, but has been naturalized in North and South America, Southern Australia, and parts of Africa. It thrives in dry, rocky soils and is commonly found in waste places and along roadsides. Identification. Milk thistle can be identified by its large, prickly leaves with white veins and a rosette of spiny, oblong leaves that grow annually. It blooms from June to August, producing purple to red flowers surrounded by a bristly involucre. Toxic lookalikes. Milk thistle closely resembles some thistles that are considered weeds, such as the Scotch thistle, Onoportum acanthium. While not toxic, these lookalikes do not offer the same health benefits and are generally tougher and less palatable. Edible parts and uses. The leaves, roots, and flower heads of milk thistle can be consumed. The leaves can be de-spined and used similarly to spinach, while the roots can be boiled or roasted. Flower heads are akin to artichokes and are best when eaten young. Medicinal parts and uses. Please note, this video is for educational purposes only. It is not intended to diagnose, treat, or cure any illness, ailment, or disease. I recommend you consult with a healthcare professional who is knowledgeable about complementary herbal medicine prior to trying anything new. The seeds of milk thistle are the most valuable medicinally. They contain silymarin, a group of compounds, silibinin, silicristin, and silydianin, noted for their hepatoprotective properties. Liver support and detox. Silymarin has been extensively studied for its ability to support liver health by promoting liver cell regeneration and detoxification, prevention of gallstones and kidney stones. It may also help prevent the formation of gallstones and kidney stones due to its effects on bile fluids. Cholesterol management. Milk thistle helps in lowering high cholesterol levels, particularly when used in conjunction with traditional treatments. Diabetes management. By assisting in the regulation of blood sugar levels, milk thistle can be beneficial for diabetes control. Antidote for poisonous mushrooms, particularly against the death cap mushroom, Amanita phalloides. Silymarin acts as a lifesaver when ingested soon after the toxic mushrooms. Estrogenic effects. It exhibits mild estrogenic properties, which may influence hormonal balance. Cancer treatment. Silymarin's anti-carcinogenic effects are being studied, especially concerning prostate, liver, and skin cancers. It also helps protect the liver and kidneys during chemotherapy. Acne treatment. Due to its anti-inflammatory and detoxifying effects, it can help in managing acne. Harvesting. The best time to harvest milk thistle seeds is when the heads have dried, typically late summer. The seeds should be fully mature and collected before they scatter. Warnings. Milk thistle should be used cautiously. Pregnancy. Not recommended for use during pregnancy due to its potential hormonal effects. Estrogen-related conditions. Those with conditions like endometriosis, uterine fibroids, or estrogen-sensitive cancers should avoid milk thistle. Allergies. Avoid if allergic to other members of the Asteraceae compositae family, such as daisies or ragweed. Milk thistle offers a wealth of health benefits, especially concerning liver health and detoxification. However, its use requires caution due to its estrogen-like effects and potential allergenic properties. Proper identification and harvesting are essential to maximize its therapeutic benefits while ensuring safety. As with any herbal remedy, consultation with a healthcare provider is advised to tailor its use to individual health needs and conditions.